In the digital age where information floods our screens, discerning truth from misinformation has never been more critical, especially regarding our health. Today, the journey has to go beyond connectivity, to information, to action. Connectivity isn't simply access to information or the lack thereof it. And access to information does not mean it has value. When the information we have access to directly affects our decisions that we make. The CIA is one of our biggest problems, and I'm not talking about spies, where any interference or disconnect can affect all aspects of one's health. The CIA triad isn't simply a one-size-fits-all, but a strategy to examine and mobilize digital and physical resources of our community. The World Health Organization defines social determinants of health as the conditions of the environment that affect a wide range of outcomes and risks, classified into 5 domains. I would extend this definition to include conditions of the digital and physical environment, and add a 6th domain, digital literacy. Digital literacy is how health outcomes empower you, me, to make informed health decisions about connectivity, community, information, and infrastructure. COVID-19, the first pandemic of its kind, drastically shifted our thinking to questions of connectivity and information, and how that information affects our actions within the community. Doubters, believers, skeptics, all alike question why and how did it happen. The constant stream of information from COVID-19 posed its own questions and exposed some hard truths of the importance of digital literacy and information within our communities. With news reports, social feeds, and discussions filled with geographical maps, analytics, and data, how does one shift through all the audio, video, and text? The CIA triad. C, connectivity and community. Connectivity and the approaches to enhancing connectivity in rural and urban communities are underlined by the importance of community involvement, public and private partnerships, and innovative approaches to address the digital divide. Successful programs such as UNICEF, Cyber Survivors, have helped youth learn digital literacy skills to help build critical thinking skills while navigating online, as well as the World Health Organization and the UK Pandemic Infodemic Management launched Stop the Spread campaign to combat COVID-19 misinformation and to ask the public to verify information. I, information. In the digital era where misinformation can spread rapidly, as valid information, it is critical that digital literacy skills are championed within the communities that we live in. This is information in action, beyond accessing it, understanding, questioning, and applying information to make informed health decisions. Action. A. Information loses power when it is not used to take action. Empowered decision-making happens when communities have access to information that helps them make reliable choices and drive collective interests. To connect, in Chicago's South Side, the People for Community Recovery has been championed environmental awareness, and fighting pollution within their communities. This has helped increase positively health education, digital literacy, and local economies, as well as around the world. Internet society has been helping to connect rural communities to the internet. Another action taker in California is Pro Remote Trust Latinas, who are community health workers that help Latino communities empower themselves with health literacy and digital literacy skills. Community, connectivity, information, action. On every continent, in rural, remote, and even in urban areas, a day without internet access is a day of opportunity lost. 37% of the world's population is still offline. Of a world population of 7.9 billion people, that's 2.9 billion people still offline. In the United States, 1 in 5 households is not connected to the internet. That's 1 in 5 households still offline. Today, we stand at the crossroads where the decisions we make about community, information, and action has the power to determine our health and the health of our communities. Together, we can transform the digital landscape. We must bridge the digital divide, promote digital literacy as a social determinant of health, and empower ourselves and our communities to make informed health decisions. Together, we can transform the public health landscape. Let's move beyond connectivity to information, to action. Thank you.